Hi, I'm Tom Geisel. At Sun National Bank, we believe that citizens need to be informed about the important issues that affect their daily lives. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Cutting-edge treatment for stroke, next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by JFK Medical Center, your hospital, your health. MD Advantage Insurance Company of New Jersey, Roche, and by Verizon Communications.
Welcome to Caucus, New Jersey. I'm Steve Adubato. You know, every year, nearly 800,000 people experience a stroke. Here to talk about the cutting-edge advancements in treatment are Dr. Sposmi Panazai, who is Clinical Director, Comprehensive Stroke Center at JFK Medical Center, Brian Fritz, who is Clinical Manager of Physical Therapy at Kessler Institute for Rehabilitation, Andrew Johnson, Battalion Chief of Jersey City Fire Department and a stroke survivor, and Sheila Dempsey, Life Coach with the Adler Aphasia Center. Dr. Panazai, I just want to clarify, Clinical Director of the Comprehensive Stroke Center at JFK Medical Center, right?
That is correct.
I want to turn to you first on this. By the way, throughout this program, you'll see a website where you can get more information on stroke, the treatment, on so many of the new treatments, so much new information out there. There's some misinformation out there right now. What exactly is stroke and what isn't it? Because it's some confusion right there. What is stroke?
Well, stroke is a general term that we use that refers to any disruption of blood flow to the brain tissue. So stroke, we divide it up into two different categories. There are ischemic strokes where there's...
Ischemic?
Yes, ischemic. So that's the dry type of stroke, where there is a blockage in a blood vessel so that blood flow can no longer flow to certain regions of the brain, wherever that blockage is. These types of strokes are basically like heart attacks, except they are heart attacks in the brain, or in other words, we call them brain attacks. The other types of strokes that we deal with are hemorrhagic strokes, where a blood...
Hemorrhagic?
Yes.
By the way, a lot of these terms will be on our website. Check it out.
Okay. So hemorrhagic strokes are the kind where a blood vessel ruptures and there is bleeding in the brain or around the brain.
Question, before I move to Andrew. The expression, time is brain, what does that mean?
Basically, this is the motto that all stroke neurologists especially use. Time is brain means that we often tell people this, that the quicker they can recognize the signs and symptoms of a stroke and the quicker they can get to their local primary stroke center or comprehensive stroke center, the quicker we can do something to help reverse the signs of a stroke. So the longer that a person has a lack of blood flow to the brain, the likely there is that there's going to be damage. So the sooner they get treated, the better hopefully the outcome will be.
911 immediately, right?
911 immediately.
Andrew, talk to us about your situation. You're a firefighter in Jersey City.
That's correct.
What were you feeling? What happened?
On the evening that I had the stroke, I woke up to go to the bathroom. And when I attempted to get out of the bed, I noticed that my leg wasn't functioning the way it normally functions. And then it was my hand that didn't follow suit with the leg. At that point, with an EMT background, I knew that there was a problem. I said something, it was some choice words, but I won't repeat it here. And that didn't come out right either. That's when I knew that I was having a stroke. And I immediately jumped on my portable radio. Being a firefighter, I have a portable radio. And I contacted the facility, my facility, which is the fire department, and told them that I was having a stroke.
How do you know?
I felt different, really different. I mean, when your leg does, there's a feeling when you sleep on your leg or they say your leg went to sleep. It wasn't that feeling. It was, I sent a signal from my brain to my leg to move. It did not move.
So how quickly before you were in the emergency room?
From the time that I recognized that I was having a stroke to the time that I was in the emergency room, I think it was about 14 minutes.
Okay. And by the way, we'll talk more about your rehab, because one of the things you told us right before we got on the air was that you have gotten tremendous support from your family.
That's correct.
Your blood family.
That's correct.
And also your family at the fire department.
That's correct.
And that has had a lot to do with your rehab, right?
That's correct.
And you said that's critical.
Oh, I think
Talk about it. I'll bring you in this too.
I think that it's invaluable to bring in the patient support system during the rehab process, the entire recovery process, whether that's family, friends, you know, your extended family, the fire department. That is far more motivating than any therapist or doctor could ever be. And
Sheila, the Adler Aphasia Center, I want to make the connection. We have a very close partnership with the Adler Aphasia Center with you know, Mike and Elaine and the whole team up there, and Karen. But here's the thing that's interesting. Connect aphasia with stroke, because I want to clarify it.
Okay. As the doctor mentioned that a stroke attacks the brain. Well, when the left side of the brain is the area that the stroke occurs, that's the language center. So an effect of that is a loss of language. So people who have aphasia have their intelligence intact, their personality intact, everything is the same, but they have lost the ability to communicate as well as they used to, and very often cannot read or write. So in addition to the effects, the physical effects, they cannot communicate as they once did. So that really exaggerates the problems that they have long term.
And because I've been to the Adler Aphasia Center many times, and Kessler has its first-rate reputation as well, and JFK is involved in this, is the modality, or are the modalities comparable for treating aphasia as it is for a stroke? Is it comparable?
Well, we are the gold mark in treating aphasia. We are internationally have research projects going on, and you know it is the top of the line. But we are a non-medical pattern that we work from. So we are the stroke patient goes to the hospital, goes to rehab,
Kessler,
and we're what's next.
Okay.
Because Andrew's been able to re-enter the mainstream by going back to work. For many people, especially without the ability to communicate, can no longer go back to work.
You have gone back to work?
I have gone back to work.
In the same capacity that you were in before you had the stroke?
Yes, I have.
Is that typical or atypical, doctor?
Yeah, it's typical.
And I know,
People
excuse me, I know that depends upon the kind of stroke, the degree of
Yeah,
stroke. That's really not a good question.
Exactly.
Doesn't it depend upon?
It depends upon how debilitated the person is. So, you know, the whole goal with acute stroke care is to prevent the long agonizing journey. If we can treat a person immediately and, you know, reestablish blood flow to the brain, we're hoping that they can get back to work and back to their normal lives quicker than they would if they were not treated.
But what's interesting is that family members, and you said this to our producers, sometimes the journey, as you talk about, doctor, the longer the journey with some families, the harder it is for some families to be patient, to stay on board. How do you prepare them for how long that journey is going to be?
Well, at Kessler we have education programs, and we have support groups that we run for stroke survivors and their families. We try to, you know, show the breadth of possibilities, and we individually mold the goals of the program to what the patient's direction, where they want to go, whether it's back home, back to work, those kind of things. But keeping the families within the whole program and the treatment is it can be challenging at times, because people want they want recovery, you know, today. They want
it now.
They want their arm back. They want their speech back. They want to be able to walk, you know, like they did, and that's the challenging part.
But is it true that you were in 23 days, right?
That's correct.
Is it true? I know every case is different, but if someone says, I had a stroke, I was lucky enough to get a quick response time, right? His brain. The harder I work, the faster I'm getting back from the stroke. Is that usually true?
It really depends on the severity of the injury and of the insult to the brain, and there's a lot more that goes
going
into
on.
It, yes.
Now, you were 23 days.
That's correct.
How hard did you work?
According to the people at Kessler, they said that I put in 100%. I worked extremely hard to get to the point where I am today. again, yes, you do want your arm back and you do want your leg back immediately. It's not going to happen. It takes time.
Describe your emotional reaction. Soon after, immediately after the stroke, describe your emotional reaction.
I would say that it would be deep depression.
You experienced depression?
Deep depression.
Describe it.
You're not the person that you were prior to the stroke. You are not that person. And you know that you're not that person. To lay in a bed paralyzed, and that's what I felt. I felt that I was paralyzed on the left side and could not move. And to know it, to send a signal to your legs or your hands, and it doesn't respond, it puts you in a depression.
What'd you do with it?
Again, with my fire department family, with my real family, and with a lot of prayer, day and night, praying without ceasing. That means every waking thought was about prayer and asking God for forgiveness and to bring me through this. I made it.
I was told you broke down for literally 15 straight days.
That's the crying. Crying and praying for 15 days straight until I had a miracle. A miracle broke through. I was able to wiggle my feet, and I started screaming until the attendants came, the technicians came, and then the doctor, Dr. Kong, came. And they said, "What is wrong?" And I said, "I can move my feet." And that was the happiest moment. From that point, we knew that we were on the road to recovery.
Doctor, isn't it interesting? I bet you see a lot of people in your work. All of you do, but I'm curious at JFK. Does it, not for everyone, but for a lot of people, does it automatically for them and for a lot of their family members change their entire perspective on life?
Oh, absolutely. You know, for the most part, we all go about our day-to-day lives, and we don't think that something could ever happen to us. And all of a sudden, you're faced with your mortality, so it's a big shock. So, you know, just touching back upon what he said before, it's key to start involving the family immediately when the patient is having the stroke.
What does that mean, involve them?
When they're even in the emergency room, when you're talking about what's happening, to communicate with them what's happening to their loved one, that they are having a stroke, that this is what we could do for them. These are the possible options as far as treatment. And, you know, depending on what they get, to always keep them in the loop and involved so that they're completely aware of what's going on. And then also once if the stroke has happened, to give them an idea of what kind of journey it's going to be ahead of time. And usually we have a pretty good idea, depending on the amount of brain that's damaged and where it's damaged, what the deficits are going to be from that damage. So we can give them an idea that, oh, they're going to have some degree of weakness here, or they may need assistance with walking, and tell them that from the beginning and encourage them to be supportive of their family member. And do that right from the outset.
But you know, it's interesting. I want to talk about some risk factors and how much of the issue of stroke or the prevalence of stroke is genetic and how much it is affected by risk factors. But the other thing I know about Adler is some of the group activities have had a tremendously positive impact on attitudes and progress that people with aphasia experience. Talk about that.
Absolutely. All of our sessions at the center are group-based. And so there is constant interaction. And I just want to address that, this continuum of care and support, long after recovery is happening.
You put that, why'd you put that in quotes?
Because it's a long journey, and people tend to think after the hospital, after the in-house rehab and maybe some continuum, then that person is where? They're back home with their family, with a primary caregiver, and that primary caregiver is saying, they're isolated. People don't call who they used to work with.
Right.
Extended family.
It's like, Andrew's good, he's fine. We don't need to worry about him anymore.
A nice family, and they're taking care of him. So
but what?
I would call, but you know what? There's so much going on in my life, I don't want to make him feel bad. Maybe he's not as physically capable. Maybe he doesn't hear as well. He doesn't understand.
But he's out of the woods.
He's out of the woods, so he's like, his sickness is over.
But what's really going on?
He's sitting home, not talking to anyone, not going anywhere, and the only person he really has contact with is his primary caregiver, who would be his spouse.
Now that's
family
hypothetical
member.
because he is back to work.
Absolutely.
He is the only, but if that were the case, because it is the case a lot,
where
what
would he
happens
go?
at your place then?
When they come to the Adler Aphasia Center, as I said, everyone there has aphasia, so they have this communication disorder, which would appear differently in everyone. Some people can say literally nothing, and
Right.
some people speak very well, but they have the wrong choice of words.
Right.
So it takes patience, as you mentioned. It takes effort. And you know, sometimes it's uncomfortable to talk with someone and they're not really making sense to you. And you know, you might not be making sense to them because it takes them a longer time to process. And that's uncomfortable. So all of these people who fade out of their lives are not bad people. They're just, as you said, we have very quick-paced lives. They don't have time to do this. But they forget that this is the same person that was always there. They still like politics. They still like sports. They still have families. They have good things happening in their families. They have bad things happening. People pass away. People get divorced. I mean, who do
But
they
it's
talk
harder
to?
to communicate.
But they can't communicate.
So let's do this, shifting gears again. By the way, log on to our website. We'll connect you to all the organizations here and some of the individuals. So like Andrew's story, risk factors. The major risk factors dealing with stroke are?
Age, high blood pressure.
Hold on, age?
High.
How old?
Well, the older you
He's
are,
a young guy.
Well, stroke can hit at any age, but it tends to occur more in older people. High blood pressure, smoking, high cholesterol, diabetes.
Okay.
You know, these are among the major
So
risk
someone's smoking
factors.
right now. They want to reduce their chance of getting stroke. Stop smoking.
They should stop smoking.
They're overweight. They're bordering on obese. They're obese. Get
They
on a
should
weight
lose
management
weight.
program. Reduce your risk of stroke. Correct?
Absolutely.
Let's talk about one of the other medications that are talked about here. And you are not a candidate for, Bill Berlin, our longtime senior producer, what is it? Is it TPA? What is TPA? And that's a clotting?
Yes, it's a clot-busting medication.
Clot-busting medication. What is it? That's what it is, right? Important?
It's very important. So this medication, you know, came about to treat stroke, but it has a certain time window that it can be given to patients safely.
After the stroke?
Yes, after the onset of the symptoms of a stroke. So when a patient first starts to experience symptoms, the medication should be given within 3 hours. In some cases where we've expanded the window to 4.5 hours, but it's a very tight window that the patient has to come to the hospital so that they can receive this medication. If the medication is given outside of the window, which it's not allowed, there's a high risk for bleeding and complications.
But EMT people prepared to administer it?
They prepare by notifying the emergency room that a patient is arriving. So they don't administer the medication themselves, but you know, they take the vital signs of the patient, they get the story, and they notify the hospital.
You were not a candidate?
I was not a candidate.
Okay. By the way, right now, when was the stroke? I want to be clear on things.
April 29th.
Of?
Last year.
Okay, so a year plus.
I'm almost approaching a year.
Okay, so I'm going to be clear because we're taping this program in the spring of 2012. Right now, compare yourself in terms of your progress to where you were when it happened. How close are you to? Normal. However you define 100%.
I would say at this point I'm about 92%. I'm about 92%. I started off in a wheelchair, unable to ambulate and unable to walk. Now I can do a two-step.
You can
now I can do a two-step.
He demonstrated it earlier.
You can do a two-step.
I can do a two-step.
No impact on your speech?
I would say that there is a little deficit in my speech. It
really?
may not be, you may not be able to tell now, but yeah, I think there's a little bit. You know what, I feel that there's a collection of saliva that sometimes accumulate in my mouth that normally that didn't happen, so I have to consciously keep moving that away. So.
But you're aware of it?
I'm aware of it.
Well, why are you shaking your head?
Just because I can see the progress and you know how well he's doing, and I've seen patients when they come back and they visit, and then they're within their outpatient stay, and talk about you know these little glitches here and there that they still are working on, but you know from all intents and purposes, you know if you're walking down the street, you're not going to be able to tell that Anthony has issues.
When someone leaves Kessler, what kind of advice do you give them?
Oh, I tell almost everybody to keep working hard, just to keep up because inpatient rehab is really kind of the first step, and
after the hospital.
Correct.
They leave JFK, they go to Kessler
for rehab for 4 weeks or so, and you know, our goal for everybody is to go home, but not everybody gets to go home. Sometimes they still need much more therapy in a subacute setting.
What does that mean, a subacute setting?
Subacute is you still need some kind of skilled services, but you may not need to see a physician every single day. You still need significant therapy program in terms of maybe just your mobility and things like that.
But don't you talk to these patients about lifestyle changes?
So, oh, definitely, yes. And that's part of our education series.
What do you say to them? 3 things that are big.
That, well, they need to, watch their diet, obviously, in terms of...
Weight matters.
Yes, and diabetes is huge.
Is huge.
Yes, because diabetes is and your sugar and can definitely impact your stroke.
Smoking, huge.
Yes, in terms of, and then exercise. And sometimes that's hard for stroke survivors because maybe they're not as mobile as they were before.
But what they can do, they should do.
Yes.
We have not talking about genetics and stroke.
Yeah, genetics.
Relevant?
To some extent. In some families, things like high cholesterol runs in the family, even despite how a person's diet is and what medications there are. It just runs in their family, and risk of stroke. It's really the presence of the risk factor. If high blood pressure runs in the family, sometimes it's a little bit harder to treat. So it adds up.
I'm sorry for interrupting. Speaking of risk factors, second stroke. Andrew at any greater risk for a second stroke because he's had a first stroke?
There is a higher risk of recurrent stroke once a person has had a stroke. And there's a high risk of stroke if a person has what we call a transient ischemic attack. And what that means is that you have symptoms, neurological symptoms that last, an hour or a few hours. The textbook definition is that anything that resolves within 24 hours. But realistically, these symptoms will resolve earlier than that. And there's no sign of damage when we do take pictures of the brain.
But there are all kinds of things that he can do to reduce the odds significantly, correct?
Absolutely.
And what are you doing right now to do that?
Well, to touch base on what he said, the physical exercise, I engage in physical exercise every day.
Every day?
I work out every day.
What's your workout look like?
Well, I go to Kessler on an outpatient basis.
Got it.
And that's a part of the exercise regimen that I'm
dance?
involved in. A little bit.
Because you talked about the two-step. I just want to make sure.
Dance a little bit.
Okay.
But I physically engage in that kind of activity every day. I work out every day. And I've changed my diet completely. Those things that you used to eat, you can no longer eat.
You changed your diet too?
Completely.
That's big.
Completely.
And go back to Adler real quick. How much progress have you seen over the years? I mean, I've seen it just anecdotally with Elaine and Mike and just amazing progress with some of your patients. How rewarding is it what you see?
It's incredibly rewarding.
And
I think it's good to mention, too, that some people will have better progress than others. It doesn't mean that their recovery isn't working, that some people have their stroke is more serious and there's more damage. So I think it's clear that we should say that for all of those people who aren't doing as well as Andrew, it doesn't mean that things are going wrong. It's just that they have a longer way to go or will have to adjust to other limitations. But life will still be full. They can have active lives. And that's important for everyone to understand.
So finally, 1 minute, we should not just look at Andrew and say, see, that's the gold standard.
Absolutely.
That's the standard for him, given his unique circumstance. What would you say, finally, doctor, to a family member watching right now, living with someone who had a stroke and not making that kind of progress because the stroke was more severe? What would you say to them?
Stay strong, be strong. Your loved one is looking towards you for support. They feel like they're a burden on you. So whatever you do, don't make them feel that way because that will limit their motivation. So just be a source of motivation, a source of strength, encouragement for them.
Do you know you've been a source of motivation and encouragement for a lot of people?
I don't know if that's the case. If you say that's the case, then that's the case. I would say this here,
Real quick.
and this is reference to having another stroke.
We'll keep talking off the air. Go ahead.
Don't panic. If you change all of your risk factors and you believe in God.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 20 years of broadcast excellence. N13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by JFK Medical Center, your hospital, your health. MD Advantage Insurance Company of New Jersey, Roche, and by Verizon Communications. Promotional support provided by NJ Biz, All Business, All New Jersey, and the Star Ledger and NJ.com, Everything Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.
If you're worried about how the Affordable Care Act affects your Medicare coverage, here are the facts. The Affordable Care Act closes the Medicare donut hole and lowers the cost of prescription drugs for many seniors. Free preventive services are expanded and copays are eliminated for yearly checkups and important procedures like mammograms. To get all of the facts for free on health care reform in New Jersey, call the New Jersey Citizen Action Helpline.
This is One-on-One. Join me as we get up close and personal with some of today's most compelling personalities.
This is one you can't afford to miss.
Weeknights at 7 and 11:30 p.m. on NJTV and 12:30 a.m. on 13.